Hello, welcome back to the Cash PT Lunch Hour podcast. This is Aaron LeBauer. Today, my guest is Adam McCluskey from the PT Initiative. Adam is I would say a younger physical therapist. He started hot out the gate out of PT school, and he's doing some great things on social media, reaching people directly, helping them without touching them, etc. So I wanted to have Adam on the show. So Adam, thank you so much for joining us today.
Yeah, thanks for having me on. I'm excited.
Yeah, well, let me ask you this. I want to get a little bit of background info. I like to introduce guests to listeners to the guests, so can you give us like the 5-minute rundown of, what are you doing? And who are you helping right now?
Yeah. So I am a physical therapist based in Raleigh, North Carolina. And so I have a in-person clinic here in Raleigh that I treat a lot of just my kind of target demographic is just active people. So I don't, it's not just like high level athletes or any specific sport, but if you have movement goals, you're wanting to be active, it's be tennis, running, cycling, weightlifting, CrossFit, anything like that, where your goal is to be more active and be able to move pain-free, then we will have a lot to work with. So that's kind of the people I work with. Just everyone's pretty motivated and has goals of specifics they want to get back to. So that's who I see. And I see people in person, and I do a lot of remote work too. So I do a lot of work on social media. So mainly Instagram is kind of the main platform that I'm involved on. Mm-hmm. And so I provide a lot of free content on there. And then I have programs on my website. And then I do a lot of remote kind of one-on-one telehealth, if you will, kind of work with people. So that ranges from performance coaching to actual rehab too. So I do a lot of kind of remote work, and that was even before all the COVID-19 stuff. So we can dive into that more later. But yeah, in a nutshell, that's kind of what my days look like.
Yeah, awesome. And how long ago did you graduate school? And you went to undergrad here in Greensboro, I think, right? Or
I did. Yes.
Yeah.
I went undergrad at UNC Greensboro, and then there was about a 4-year gap between undergrad and when I went to get my DPT. Mm-hmm. And so I did my doctorate out in California. So I went to Chapman University in Irvine, California.
Okay, awesome. What inspired you to go to PT school? Like, what was the 4-year gap?
Yeah, so it was always kind of on the radar, but it was one of those things where once you take that plunge, I mean, you're doing the GRE, then you're applying, and it's a financial commitment to apply, and another 3 years. It's like there's a lot of upfront. Like I just wanted to be sure 100% this was the path I wanted to go. Yeah. And at that point, I was doing some coaching and like fitness training and things like that, and I was like, I like working with people. I'm already working with active people, through personal training. I want to kind of run this out and kind of see where it goes. And so I did a lot of personal training, coaching, that sort of thing for a couple years until I just got to a point where a lot of people I was working with, there were people that had kind of, if they had injuries, that's, the people that had the nagging injuries or anything like that. And they were like, oh, I can't do this or that. Those are the people I was always kind of drawn to working with instead of more just I want to come in for a 30-minute like fat burning circuit. I was kind of always finding those people that no one else wanted because we had to problem solve everything. And I was like, this is getting real similar to what a PT does. I'm wanting to like fix the problem instead of just say, what are we working around? Mm-hmm. So that was kind of the light bulb moment. I was like, all right, I think that's kind of, a sign that is where I want to go. And so I'm honestly super glad that I did that. I think that background in training and coaching has paid dividends. Mixing and blending that with what I learned in physical therapy school has kind of created a pretty good, a unique perspective, I think. I know there's a lot of people that have had fitness backgrounds, but I think it provided a unique perspective for me to kind of interpret and digest that information from physical therapy school and then kind of apply it to who I'm working with today. So that's kind of the reason for the gap. Yeah.
Right on. That's cool. Well, I had a big gap. I had like a 10-year gap.
There we go.
Was there, when you went to, when you decided to go to PT school, you had all your prerequisites and everything. It was just made basically a decision, or was there like a difference? Because I want to say this because when I was in California, I thought about going, but I couldn't. It was going to take me 2 years of extra coursework to apply.
Yeah. So luckily I did sports or exercise science was kind of my sports medicine concentration was my undergrad degree. And so I had pretty much all those core courses. There were 2 classes I went back and just kind of I retook again just to get, I think I had like a B in them and I wanted to have an A because I was just like, I only want to do the application once, you know?
Right.
So I retook 2 classes just to make sure I had the highest grade possible. And then I took the GRE. So, overall, I think it took those classes in a fall semester, and then took the GRE later. So it was about, a 6-month kind of prep period, but yeah.
Right on. Did you have a PT experience yourself, and that's why you kind of knew that was your path, or was it more of like just from fitness training stuff, you knew I got to get the next level?
Yeah, it wasn't. I know a lot of other PTs like, tore my ACL or, broke a bone or this, and that really wasn't my experience. I've always just been active and I guess just kind of doing some self-reflection and like kind of having experience, working with other PTs and kind of seeing what they do and just kind of being exposed to it and then kind of reflecting on the type of work I would want to do. It just seemed to be a good fit. And so, the further I went down the training route, I think that just kind of confirmed it a little bit more.
Yeah. Right on. Awesome. You talking about your experience with as a trainer. Why do you think people gravitate to trainers, and even trainers gravitate towards the edge of fixing people? Like where do you I see it as a gap from physical therapy. Where do you feel like that comes from now that you're on the side of physical therapy? You know what I'm asking? It's like, because people, I hear a lot of trainers that are like, well, I can fix that, whether they stretch it or roll on something, or they try to correct the problem rather than saying, hey, look, you need to go see my buddy, Dr. LeBauer, Dr. McCluskey. They'll take care of you and I'll keep training you. Like that doesn't happen as much as it should, right?
Yes, I agree. Honestly, I think there's a couple answers. So I think on the physical therapist side, it's, in general, like we have a generalized profession. If you look at the boards, that's, you're answering acute care questions and orthopedic and neuro. It's a very broad kind of base of, what we have to know as physical therapists. So we're kind of more of a generalist in most cases when you come out of school,
right,
unless you've taken other steps for that. And so sometimes there can be some confusion on, what does the physical therapist do? Like, do they work, if they're seeing a personal trainer, usually they're more active and maybe they don't know any physical therapists that are kind of have a reputation of working with athletes. Maybe they just, all their experience with physical therapy is working with, 75 plus, doing some light, resistance bands and some basic stretches. And maybe that's the only experience they've, those are
all
classic.
The time. Yeah.
Everybody gets them. If you got a shoulder injury, you get those. So, and maybe that's the only experience they've had. And so they're just kind of, it's one of those things where I'm not going to send this person who's paying me, like this is a source of income for me. I'm not going to send them off to somebody and I don't really know that they're even going to help them, and risk of not seeing them again. And so I think that's one side. It's a little bit of ambiguity on, can a physical therapist help my client and what do they even do?
Right.
And then I think there's a little bit of, and I always kind of I don't want to put it on other professions. Like I always kind of, I fall on the side of what can we do better to bridge that gap instead of saying, hey, you guys should do this. And so I think we could do a better job of communicating and, reaching out to other personal trainers and fitness professionals and like, this is what we do. This is how we can help. This is kind of where I'm at, and this is where you are. And if we partner together, it's actually a great fit for the client overall. And so, but as we both know, territory wars are a real thing, and people kind of have a little bit of a scarcity mindset of, if I send someone to someone else, I may never see him again.
Right.
And so I think there's a little bit of that. That's kind of my two sides of it, I think.
Yeah, I think that's good. I think, I had a similar experience with massage therapy because I was doing that first, and it's very similar. And I think that as physical therapists, our professions kind of drop the ball, and it's not one person's fault. It's because I like the point that you made that we are more of a generalist profession. And people sometimes think they need the physical therapy. I'm like, the physical therapy, right? But it's, if we can define better and educate better, then we can bridge that gap, right?
Exactly. Yeah. And I think that's on us. I think we have every opportunity in, this day and age. I mean, everyone has a platform, whether you want to have a YouTube page, Instagram page, Facebook page, there's a platform for you to get your voice out. Even if it's just local, it doesn't have to be online. There's ways you can make it known what you do. And so, I think we should kind of take it on ourselves a little bit to, if we're complaining that we don't see the type of people that we want to work with, or people don't understand what we do, well, let's start. What are some real ways we can get the word out about what we do, and how will people know, instead of just kind of griping about it and wishing it would change. There's a lot of options, whether it's internet or local marketing, to kind of let people know, look, this is what we do and we can really, really help.
Yeah. Awesome. Like if you're talking to a trainer locally, how would you explain to them what you do as a physical therapist and, movement specialist,
Yeah. So, and I usually kind of start off I think the biggest thing is looking at our background. So, as far as I'm, things with, periodization and training and programming, yes, I can do those things, but that's what they do, every single day. And, working on building programs for fat loss and kind of, giving consultation on lifestyle advice and things like that, all which we can do. But kind of my specialty is with, pathology. So if you have, movement issues or old injuries, and kind of understanding the pathoanatomy of things, biomechanics, that sort of thing. And so that's kind of my specialty of if that person, if we can work together to make sure their movement patterns are right, if they've got an old injury or a contraindication, of just kind of, I can kind of help in saying, okay, this is some things that we might want to avoid. These are some good alternatives. Just kind of coming from that point of expertise, and not saying, I'm just going to take over. I know more about everything than you do, and which is, not true. There's just a sector of, those types of pathologies that we have that's our training. That's why we went to get a doctorate degree, for 3 years after undergrad to learn about. And so I think, if we can kind of help provide some insight, if, they had a rotator cuff injury or an old, surgery or something, and it seems to bug them, we can kind of give some advice on that. And so that's kind of where I would come in and say, here's some ideas for working around those things. If you feel like you're not sure where to proceed with these, I can see them for a few sessions and make sure they feel good and comfortable about knowing how to work with, their specific injury. And then we can communicate back and forth, just so we're all on the same page. That way the client feels good about the exercises they're doing. I think just the more the client can know that the trainer and the PT are communicating for their best interest, I think everyone wins there. So that's kind of the approach I usually come with it.
Yeah, that's awesome. And what are the most common, the most common injuries or most common problems people have that you're seeing that they might be working with a trainer, which you getting involved has helped them, dramatically in their, in the patient's, clients, like fitness goals, et cetera? Like, what are the number one, two things that you see?
Yeah. And so probably the top three things that I work with in my clinic are shoulder pain, hip pain, and low back pain. And those are kind of the two. And I think it just kind of fits with the type of people I see. So just a lot of, whether you're doing a lot of overhead stuff, repetitive motions, lifting, those three areas are typically some of the most heavily involved. And so I think the biggest thing that I usually do with, and kind of my collaboration with different coaches in the area is, the coaches will send people to me just because they're going through certain exercises, and they always seem to have, whether it's a certain type of movement, they're having some pain. And usually the coaches try to modify and kind of change, and say, hey, let's scale it back and try this exercise. And sometimes it's just kind of, something got irritated and it's overused. And if you scale it back, add it back in, it's fine. But usually those cases where something's kind of continuing to nag on, a lot of those are kind of shoulder and low back issues. So, a lot of CrossFit coaches in the area just kind of, there's certain like cleans and snatches and any kind of muscle ups or anything like that. They're just having very specific type of pain, but they can do a lot of other things, but you get some shoulder pain with specific, movements. That's kind of when they're like, well, I'd want you to get this, have Adam look at it, see what he thinks, give you some exercises that you could, based on an assessment, what you could do to kind of improve that. And so I kind of view myself almost as a little bit of a consultant in that realm, is like, there's an issue and let's go through a full assessment so I can get a full picture of what's going on, instead of just throwing, these usually work for shoulders, that doesn't do any good. So, kind of doing a consulting session of, this is what I see, and here's a few things to do, and this is what I would stay away from for the next 2 weeks, and this is what I would kind of replace that with. And so I think the big thing, especially with CrossFit boxes and other, private training studios, I think a value that I like to kind of present is I want them to stay in your gym. I want that client to continue. I don't want them to cancel their membership or freeze their account or anything. I want them to keep working out because, again, that's our shared goal. Physical therapists and personal trainers, get people moving, strip it all down. Having people stay healthy and move is our goal. So, and that's kind of a little bit of a value proposition of I'll give some consultation. They can stay working out. They're not going to go crazy. I'm not going to tell them just don't work out for 2 weeks.
Right.
Which, as we both know, is common advice that you can get in the medical community.
Way too common. Is there like are there one or two assessments or self-assessments or things that you teach other trainers or patients or even people through your Instagram, social media accounts that they can test on themselves to know when they should continue training or when they need to see a PT? Is there like one or two like really like awesome ones that, myself or one of our listeners might just know, and it feels too common to even feel special, but that you found, is really helpful for people?
Yeah, I think, so especially for my overhead athletes, so, CrossFit, Olympic weightlifting, anything that, even, baseball players, anything that's a lot of overhead repetition, there's something basic. If someone's having, they're trying to do kips in their CrossFit class and they're having some anterior front of the shoulder pain, one of kind of, I call it like low hanging fruit is, we don't need to get into all these special tests, but you can do just a basic lat test where you're lying on your back, knees up, try to keep your back flat on the ground. And can you get your arms overhead where your hands are touching the ground? And if you've got a big gap there with your arms just kind of, hanging there freely and you can't get your hands back to the ground, it's given some indication. There could be other things, but given some indication that you've got some lat mobility issues. And if you're trying to go into a good, clean, kipping pull up or get anything overhead for any significant weight, that's going to be one of those things that maybe it doesn't hurt now, but it's one of those things that I would want you to look at and start to address before continuing on. Because exactly. Yeah.
If you're listening, not watching, go watch YouTube. I mean, I don't have full flexion in my shoulders. and I spent years racing bikes, and it could be partly from that, and I've spent years trying to undo it. But yeah, I know what you mean. Like, can you do that, pass that test? I don't really.
Yeah, well, and that's one of those things too that I, just kind of talking about those easy screens is sometimes as physical therapists, we want to jump right into the really, really complicated, when sometimes you can just step back and let's start with the basics, start with the low hanging fruit, if you will. Like what's there before we, rush into training, infraspinatus at a 45-degree abduction. Like before we go that deep, is there something just mobility wise, like lat mobility, like we just talked about, that we could clean up and make a world of difference? Yeah. And so I think that's that.
What's the top one for like back pain? More like a hip hinge type of thing or something like that? Yeah.
So when I'm looking at back pain, obviously that's going to be one of the more, multifactorial complex ones, but a lot of times I see, exactly what you said, I'll look at a hip hinge. So I'll kind of use a dowel or like a PVC pipe and just kind of put it over the back where they've got those 3 points of contact at the head, the mid back, and around the tailbone. And can they go through an actual hip hinge? So a lot of times, whether it's as a result of a back pain or a back injury, sometimes there's a difficulty kind of disassociating that lumbar spine and the hips. So moving them independently. Can you keep that lumbar spine at a relatively neutral angle and bend forward at your hips? And there's a lot of people that's just not a possibility for. They don't know how to do that. And so that's one thing I would want to look at. And then kind of looking at someone's squat. Sometimes they're trying to, stay forced into they've been told a certain way to squat, and it may not be a good fit for them based on whether it's their mobility or how they're designed and shaped. And they're trying to fit their squat into one real narrow toes forward. And then when they get to it, they run out of hip mobility and it's stall lumbar flexion and things like that, where you can just kind of change foot position and hip position when in a squat. And then teach them to kind of how to sequence the squat and go into it can make a huge difference and not feel any of that pain. And so, like you said, I like kind of those quick, results driven type of assessments where you can say, this is an area we can work on, let's clean this up and then see where we're at after that.
Awesome. Is there, I mean, I know that you didn't learn all that in PT school because, we don't, right? Like it's possible. Was this some of the stuff that you've learned beforehand in training, or did you go to do specific Con Ed, or is there, anything that you've done, or like, is it just you reading stuff? I mean, where'd you learn all this? What are the best resources for some other people?
Yeah, it was funny. So I was actually asked this from a remote patient, I guess last week. And we kind of went through some things and I was explaining what our findings were and what tests we went over. And then his comment was just kind of like, he started kind of laughing and I was like, what's going on? And he's like, why hasn't any other PT ever like told me these things? Like, why aren't we doing those things? And why haven't they told me these things? And honestly, at the moment, I was like, I don't really know what to tell you. I mean, I just try to continue to get better and understand movement. I think the thing with the background in training definitely helped. So I think the whole goal with training was to, try to get people to move into different positions and kind of own their own movement. And so just having a background in training and moving myself. And a lot of times I just kind of, in my own sessions, I try to find different movements and ways to work different muscles and movement patterns. And so I kind of use myself as a guinea pig a little bit and try to piece things together. I can't really point you to one specific book or, one course. I think the big thing that I like to do is look at principles. So sometimes I get kind of frustrated with the continuing education world because I feel like there's a lot of pigeonholes. Like you go to one course, you have to take all 14, and then everything that you ever do with a patient is with that mind frame, your mindset.
Yeah.
And then there's other courses where, it's a kind of a different rabbit hole. And so what I like to do is kind of take, what are the main principles of each of those? So, there's some courses that focus on end range joint control. I think that's important. There's others, rib cage positioning and breathing, I think that's important, but I don't necessarily want to give myself a label and put myself all the way down that rabbit hole. But I think the big thing, if I could give any advice, and I don't know if it's clinicians or new grad PTs, is just try to understand principles and systems of how the body works. I think that's the biggest base of kind of, what would make a big difference. So I think there's this innate kind of desire to have a cookbook. And by nature, our job is not cookbook. Like it's not follow these 4 steps to get this result. And I kind of always, when people ask, they'll sit, on Instagram, they'll send me an MRI report and they're like, hey, what do I do? Right. Here's my MRI report. What exercises should I do? And I always think if it was that easy, you could plug that into Google and we would not have a job. Right. If it was A plus B equals C for whatever, the variables, then we would be out of a job. And so there's so many other factors. So that's why I kind of say, try to learn every exercise possible. Look for those principles of movement. So, how does the body interact together? So that's kind of what I would focus on. That's what it's been my goal. Not so much try to get as many certifications as possible, but try to understand the principles of how our body moves as best as possible.
Right. Awesome. What are some of the things that you look for? And well, let's go into, I want to talk about how in your clinic in person, you do exercise-based therapy, but you're also doing manual therapy, right?
I do. Yes.
Yep. Prior to the coronavirus, would you say like you're doing a little bit, a lot? Like how much of your practice was, hands-on?
So that would depend on the person, but I would say so on the early sessions, it depends on the injury, but on the early sessions, there may be a little bit more manual. And then as we continue through, that should get less and less.
Yeah.
And so usually after a couple of visits, there's almost no manual, not as far as like soft tissue work or joint mobilizations. Maybe there's kind of some, testing in range, like joint position and anything like that. Right. But, never really any more than 25% of a session would be manual.
Yeah. And you've been doing like remote coaching, remote sessions for a while, right? And you can't really do manual on that. So how have you been able to be, I just want to know from your perspective, what you're doing, how you're treating patients. Is it being effective over video or even on the phone? Is it more hands-on? Is it more the evaluation, the decision-making process, or education, or the exercise? Like, where do you feel like the strengths are, the things that matter the most? And, like, just why do you feel like you're doing okay doing doing remote coaching, which you clearly are, and a lot of people are scared of it. So can you just share a little bit about that?
Yeah, for sure. I think so. First of all, I'll say, I think everyone, if you're a clinician and practicing it and want to be able to be a practicing clinician, doing a remote session, I think is invaluable. I think whether that's what you want to do full time or not even part time, but just occasionally, I think it's invaluable to do, because I think there's a tendency, and I'm kind of talking to myself, before doing all these things, there's a tendency to have, palpation and soft tissue and joint mobilizations and manual, to kind of have that as a safety net. So say a patient comes in, they've got some pretty unique symptoms. It doesn't seem to fit your normal categories, and your brain's kind of spinning. As you go through the evaluation, you've tried your normal routine, and then you get to the point where, like, I'm not so sure, like, what's going on. Then there's always palpation. There's always putting your hands on the person and doing soft tissue. But I think it's a powerful thing to put your hands on people, but it shouldn't be a safety net. So it shouldn't be, if I'm out of answers for this person, I'm going to still act like I have answers, and I'm just going to start like massaging where it hurts. And I think that's kind of what happens a lot. And then the next time it comes in, the person comes in like, yeah, it felt pretty good. Like you dug in there. It feels a little bit better. And you're like, all right, well, I'll keep doing more of that. But you never really turn on that critical thinking, like, all right, well, why is it hurting there in the first place? And so I think it can be there as a safety net. And I think what I love about remote sessions and telehealth is you don't have that safety net. If you're viewing manual as a safety net of, if I get in a bind, I have it there. You don't have that with the remote session. So it kind of takes that option away. And I think it puts us in a position where I really have to understand, one, I have to get a good history of the person and kind of connect to them. I have to, all those other skills that we have as PTs and we should have, those are kind of accentuated a little bit. And so take a good history, talk to them, kind of know where they're at, and then actually know how to assess their movement, know which positions to put them in, that it kind of expose some of those things that we need to work on. And so that's kind of been the invaluable thing. And obviously the more you do it, the better you get at it. But I think that's the first big thing, is that. And then the second would be just kind of realizing we're not technicians. So, we're going through things with a person in front of us, and we're not just, I'm here just to do your joint mobilizations and your soft tissue and your dry needling, and then someone else can do all the rest of it. I just feel like that kind of shortchanges what we went to school and went into all this student loan debt to do. Is we're practitioners. We provide solutions and guidance and reassurance and things like that. And I think when you have someone on a screen across from you, they're looking to you for, what can you tell me about what's going on? Give me some guidance. I'm talking to a professional. Like, this already kind of gives me some reassurance. Those are skills that we have, and I think we need to highlight. And so I'm not saying that the manual is not important. I think it is. But I think it's helpful to have those remote sessions to kind of make sure you're honing in on those other skills that are equally as important.
Yeah, that's really awesome. And I think it's a great perspective and very important. I think that, in our clinic, we've been heavily manual. I started as a massage therapist, and everyone told me, well, I've seen a bunch of PTs and surgeons, and they didn't ever touch me where I hurt. I'm like, we're always going to touch people where they hurt, just to even at least give them the confidence we can do that. And I've helped so many people around the country, friends, family members, et cetera, just by talking to them over the years. A lot of my ebooks and videos were made because of that. And in the last few weeks, it's become apparent to us and Caitlin, who's our physical therapist, that there is a whole lot more that we do. And I've known this, but there's a whole lot more that we do and we can do and be effective in doing education, problem solving, encouragement. It's like almost like people can get a lot of the other stuff in a box at REI or Walgreens, right? Like
Exactly.
You can get a roller or a ball anywhere, but it's where to use it, how to use it, and and to understand what's next.
Exactly. Yeah. And again, like I think there is a huge value of if you have someone in person, you need to put your hands on them. You need to, it kind of is part of the whole experience really is you need to put your hands on somebody. And again, for that reason, like it kind of shows like I'm listening, I'm paying attention to what you've told me. You told me this is where it hurts. We're going to find those things out. But I think it's a matter of looking at, we do have a lot of things to offer. And I think that's kind of when I think people are a little bit scared to do remote, I think it comes from a little bit of that mindset. Like, manual's what I have to offer. That's what, that's kind of, they think that's what separates me from anyone else is I can put my hands on people and do joint mobs. Yeah, that's true. But let's think bigger about our profession too.
Yeah. When someone contacts you and you're like, hey, we're going to do it on video, or we're going to do this over the phone, and they're like, oh, well, don't I need to come and see you? Or don't I need to, how do you kind of handle that? Or people not even objecting to those things?
So pre-COVID-19, that I got a little bit more objections to that. And so it was a little bit of, I don't know if it's just kind of my situation too. So a lot of people that would reach out about doing a remote session have found me on Instagram. And if they're not, within driving distance, they kind of probably assume that that's going to be part of the deal is they're going to, have to do something remote. And so I think some of those people, if they were a lead from Instagram, were kind of already expecting that. But I think the big thing is I kind of just walk through the process a little bit. And so I think that's such a big thing. I think I'm just speaking again from kind of what I used to do and what I've observed is sometimes we assume that people know what PT is going to be like or what the experience and what working with us entails. And I think most people don't. So kind of that's really what I do is I explain. Well, first of all, I ask them a lot of questions and I get them to tell me what's going on. I know about them. I know their pain points. I know what they want to work on. And then I basically kind of walk them through the process. This is step one. We've got to really get a base of, I need to see you move. I need to see some of those underlying issues. What are those root causes of what's going on? And I kind of just reassure them, like, the main goal of this is we're trying to find the actual issue and not just manage your symptoms. We're trying to get to the main issue. I'm going to help you understand what's going on with your body and get to a point where you don't necessarily always need to come see me anytime something happens. I want to give you some tools to have in your tool belt for kind of independence and longevity too. Yeah,
that's awesome. What kind of techniques and strategies, like clinical strategies, are you using over video? And and by the way, are you doing phone or video? Like, are you doing a little both? I probably should ask that.
So I try to do video for everyone.
Yeah.
And so for the most part, I've been using this platform Zoom to do most of those calls.
So let's say you get in, you've evaluated your patient. They're like, yeah, Adam, let's do some sessions. What kind of treatment strategies are you using? What kind of techniques? Like you can't reach through the thing, like how are you getting them especially if they have a mobility problem? How does that go in one of your sessions?
Yeah. So usually the first 15, 20 minutes so I usually have them send me a lot of information on the front end so that when you are on the call, I can kind of just focus my questions in it and fill in the gaps. So about 15 minutes, we're talking and just kind of seeing face-to-face, building some rapport. And then, that next, 20 or so minutes, we're going through some specific, based on what they told me, some specific kind of movement assessments. So I'm kind of telling them, this is where I want you to face the camera. I would get in this position. A lot of times I'll demonstrate the same thing. And so then I get them to kind of verbally communicate what they're feeling and I can see those things. And so just basically visually, I can get an idea of what's going on with them. And from there's going to be a few things that I know they're going to be in the plan, just kind of what I saw. And I kind of get an idea of what they have there. And I want to walk them through some of those more technical movements. And so I do spend some time going through, this is what we're focusing on. This is what I want you to feel. This is what I don't want you to feel. This is the goal of that. And so some of those more intricate movements I go over on the call.
Yeah.
And then a lot of the work goes into, I send them pretty detailed explanations and programs of what I want them to do between calls. And so that's kind of, they know up front, I'm giving you guidance. Like we go over this call, I'm showing you, this is where we need to work on. This is what we need to work on to get to the bottom of your issue. And I'm going to send you exactly what I want you to do. And kind of make sure they know there's some work that's involved on their end.
Yeah.
They need to be consistent in order to see results with it.
Right. Let's say someone's got like the lat mobility issue. Are you having them like, hey, make sure you got a roller or some kind of ball or something like that with you on, and I'm going to teach you how to use it or show you where to use it? Is that kind of stuff you're doing too?
Yeah. So typically, we'll take a lat mobility issue first. So if it's a lat mobility issue, some people I'll use a foam roller. And I usually kind of go through a sequence. So I usually do, if I do have a more targeted, like kind of passive intervention, like a static stretch or a foam roller or lacrosse ball, I usually start with those. And then I'll progress to a little bit more of an active mobility movement. And then we'll progress to more kind of strength training movements. So it's strength training movement is going to look different for everyone else, but I kind of usually use that same sequence of more of a passive movement, more active movement, and then more of a training strength movement, and just kind of go through that process.
Right. Awesome. That's awesome. What are some of the things that you've run into using video that like have made it just not work? Whether it's like people not knowing how to use the internet, like just common things, pitfalls, or, certain maybe conditions. It's just like, I can't help you, or this isn't working. Like,
yeah, I think that's, well, it hasn't happened a lot, but if it can be frustrating with the internet, if the internet's choppy, and like with Zoom, if, someone's going through emotion and then the audio and video or audio and voice cuts out, it's real choppy. It can kind of get you flustered a little bit because you feel like, all right, well, I need you to do that again. What'd you say? And it can kind of like throw off your vibe a little bit. But, outside of technical issues, I think the big thing it's exposed is you have to really be able to verbalize, what you're looking for and what you want from them. Just because you're not there and you can't just like say, touch their shoulder blade and upwardly rotate. So I think that's a big thing that, you have to make sure your verbal skills are zoned in there. And then the other would be, I guess, in cases where it wouldn't work, would be more, I guess, acute issues. So I'm thinking not necessarily acute, but more post-op issues. So, that's one of those things where it's kind of hard to go, if you're having to do passive range of motion on a joint, like, that's a tough thing to do remote and virtual. And so I can't really provide much insight on that because most of the people I work with, that's not really my population. Most of my people are pretty active, and it's, mobility, strength, specific training issues that they're dealing with. And so I haven't really encountered that much, but that would be a roadblock where I would say, well, maybe we explore some different avenues there if that's your situation.
It's hard to self-mobilize a shoulder when one's immobile.
Exactly.
And the last patient I had that had like a total hip replacement, this was about 5 or 6 years ago, I was like, oh, he's in the hospital, let me go visit him. And I showed up and they're like, he's already been discharged. I'm like, what? He was in for like less than 18 hours. I was like, holy cow. Okay. Like there's a lot of, I don't know, like, it's not my patient population either, but that is a very different kind of setup. But I can see where even just being there to be, a consult, have a consult here and there, but, it's not my patient population either, because people think PT is post-surgical rehab. Right.
Yeah, exactly.
And that's the technical, like you follow the technical, you go to the PT, everyone goes to the PT that does that technical service, and they kind of come to see us when they get back and they're like, wait a minute, something's still not right. Is that kind of the same type of person you see? They're like, I've had this, it's been a year or so or more, but something's still not right. I can't do my lift and, all these things, right?
Exactly right. Yeah. And that's pretty right on, which a lot of people say. And a lot of people have, especially I see a lot of shoulders, and a lot of people like, I had a labrum repair, 4 years ago, and it's just never been the same, and it's like, I think part of the issue is as people rush into those elective orthopedic surgeries when maybe it was the right decision, maybe it wasn't. So sometimes they're cleaning up some messes there. But a lot of people have told me I've done this, I've gone through this procedure, this operation, and something's still off. Sometimes that makes me want to bang my head against the wall. Is there a certain
phrase or thing that patients say and you just hear it over and over again? You're just like, if I hear that one more time, I'm gonna bang my head against the wall. Is there anything that you hear on a continual basis that you wish you could change?
Yeah, honestly, I think the big thing is when people, so if I'm talking to somebody and, I'm kind of asking questions about, let's say it's like a low back issue and they're having some numbness or tingling down the leg, any kind of ridiculous symptoms, just kind of almost assuming I need to go to see the orthopedist, or I need to see the orthopedic surgeon, I need to have an MRI. When there's literally all the evidence points to that's not where you need to go first. Right. And so I think it's almost this understanding of, I need to know I hear this a lot. I need to know what's going on in there. And so it's always an interesting conversation, because one, you don't want to discredit that. Like that's a real emotion. That's a real feeling. And it doesn't come from a place of, I don't trust you. It's more of, I have a pain and I'm looking for a solution. And this is the solution that makes sense, is I get a picture taken of the inside of my body and it finds that one, whatever it is that's causing me this pain. But we kind of know as physical therapists, it's never that straightforward. Right. And likely you're going to find something that's been there for 8 years and your pain started yesterday, and they're going to say that caused your pain. Right. But for the last 7 3/4 years, it didn't. So, and then you get pushed in, that's there. I see it. We need to do surgery. And you may have had a surgery that you didn't need. And so I think that makes me bang my head against the wall a little bit, but it's also the reason why I put out so much information on social media, is to put it out there of, this is not your only option. If you're having this pain, there are, in this field of physical therapy, there's a lot we can do. Like it's actually, research proves it's the best first route is conservative care. And so,
yeah. Do you think that's the number one thing we can do about it, is to put that message out through like our social media channels and YouTube and all those other places? Is there anything else we should be doing?
Yeah, no, I've thought about this, and I think, I guess, and other people may have a different opinion, and you may have a different opinion, but I think for a long time, the solution was always, we need to go kind of prove value to the surgeons or the orthopedist or whoever the MD is. And I've never really been 100% on board with that. I've always kind of been on the side of, I think what would create real change and make PT the get PT first movement, that to kind of give that some legs, is to start to go to the public, where we make it known. We advertise that we are the first option. We have results, and you don't need to go to surgery and that sort of thing. I think getting the word out, whatever your platform choice is, getting the word out that we can intervene that way, and you don't have to go this one route. I think that's kind of where the change is. And I think we have enough people, if they do go to the orthopedic surgeon, they say, well, there's a PT that's gotten a lot of people good results without surgery. And then every other patient that comes in with that similar issue is recommending themselves PT. I think that's kind of when there's going to be a paradigm shift. I think until then, it's going to be status quo, because you come in, you got a disc bulge, you're getting surgery, like that's kind of it's going to be hard to break that unless the patients themselves are coming in and kind of disrupting that.
Yeah. I haven't set a timeline on this, but what's today? 2020. By 2030, people should be saying, I know I need to see a PT to know exactly what's going on. I completely agree with what you said. And I think that it's something that we have to get in front of patients and change their mindset over time, that they need to go, I know I need to see a PT to know what's going on, which is, what's interesting is 20 years ago when I was a massage therapist in California, people would say to me, Aaron, I know I need to see, when I tweak my back, I know I need to go see my massage therapist. Because at that time, PTs didn't have direct access to me. Didn't until a few years ago. I had a couple people say that to me. I was like, wow, okay. That was, Bay Area. I'm like, I want people here in North Carolina to know I need to go see Dr. LeBauer, Dr. McCluskey, or just a PT to know exactly what's going on. Screw this other stuff.
Yeah.
Right?
Yep.
So,
no, I think it's a good goal for us. And, I think there's always this tension in our field of, we want this, we want to people to respect the title of doctor, and we want all these, things that come with it. But I think that's kind of how it gets there, is people recognize the value. And I think that's what I love about having my own business and entrepreneurship is, the value, whatever value you can provide and display, that's what you get. It's not based on anything else. If you can provide value, then people will come see you.
That's so awesome. What, what other question didn't I ask you that you think would be helpful for our audience?
I think just, and we both do a lot with, trying to, social media, Facebook, Instagram, email, those sorts of things. I think if anyone is kind of on the fence of thinking, is social media, is that stuff, is that a kind of a phase? Is it going to just die out and it'll be, another thing in 5 years? I think one thing I've realized it's been pretty impactful and I guess kind of eye-opening for me is that people are searching for healthcare options on those platforms, whether they know it or not. I think the days of I'm going to my primary care and they send me to this PT place and no questions asked, I go there and whatever they do, I listen. And if it's good, bad, I don't know how to discern. I think those days are coming to an end. And I think people are shopping for healthcare on Facebook, Instagram, Twitter, whatever platform it is, whatever online. I think that's kind of where people are taking more ownership of their own healthcare and finding answers for themselves. And so I think, encouragement would be put yourself in those places where people are searching. If you believe that you can make change with that population, put yourself there and put value into it. And then people will find it. That's kind of, I think that was an eye-opening thing is people are actively searching for healthcare options on social media. It's easy to think it's just a place where people post cat videos and things like that. But, there's a lot of people that really are searching for answers to real problems on social media. And so I think it's been pretty cool to kind of be in that place and be able to help people through it.
That's awesome. Have you checked out TikTok yet?
So first of all, no, I haven't. I think it's a cool idea. And I'm not like opposed to it. There's just, it's more of a capacity thing for me, I think at this point. And it's one of those things, if I got on it now, I'd probably end up just watching videos for 2 hours and maybe not.
It's funny. Like I've done like 5 or 6 videos. The first one I did where I messed it up and just published it anyways has gotten the most views. All the other ones I've tried to plan out with my kids, even like 200. I'm like, whatever. I'm too old for this. I'll move there later. But it's like the next upcoming platform. I mean, it's going to be huge. That's awesome, Adam. Well, if someone wants to find you, I know you're mostly on Instagram. Where do they find you on Instagram? What would be your website if they want to go check out what you're doing?
Yeah, so pretty much everything is going to be under the name of the PT Initiative. So on Instagram, if you look up the PT Initiative, that's where I post most of my content. So there's a lot of free stuff on there. My website is theptinitiative.com. And so that's where I kind of have all of if you're interested in some programs and some things that I've designed, just to help you out with, knee issues, shoulder issues, back issues, any training programs like that can be found on my website, theptinitiative.com. So those are kind of my 2 primary areas where I hang out. And so go check me out at one of those, jump on the email list. I'm sending out some more, newsletters and updates and things like that now. So just shoot me a message and shoot me a DM or an email if you listened and say, hey, and we'll talk.
Cool. Awesome. Well, thank you very much for taking the time to come on the show. I really appreciate it. Well, if you guys are interested, listening, whatever, go check out Adam at the PT Initiative, follow him. And if you got anything from the show, make sure you snap a little screenshot and shout us out on your Instagram, your story. But if you're not on Instagram you're probably on Facebook. If you're not on Instagram, go get on Instagram and make sure that you let everyone know what you're doing, who you are, so they think PT is the best first option. I mean, that's the goal, right?
That's it. I love it.
All right. Thank you, Adam. Thank you all for listening. We'll see you on the next show.